Hi, this is a discussion about the timing and stages of breast reconstruction as part of the Breast Reconstruction seminar series by West County plastic surgeons of Washington University. Breast reconstruction is usually performed in stages. Chemotherapy or radiation therapy, when required, impact the timing of reconstruction. Radiation therapy in particular favors reconstruction with your own tissues when possible, although breast implants may still be an option. In patients who do not require chemotherapy or radiation therapy, there are often several options for reconstruction available. One of these is to use a tissue expander. In this case, a tissue expander, which is essentially a deflated breast implant, is placed underneath the chest muscle and breast skin immediately after the mastectomy. Then, over the next few months, the tissue expander is inflated. Then the tissue expander can be replaced with either a silicone or saline breast implant. Either at that time or at a subsequent operation, balancing and touch-up procedures can then be undertaken, such as breast reductions, breast augmentations, or fat grafts, to further improve the result and improve balance between sides. This can then be followed by a nipple reconstruction and an areolar tattoo. In other cases, the nipple and the areola can sometimes be spared. In these cases, all of the breast skin is left, leaving the entire breast skin envelope. In this circumstance, a breast implant can often be placed immediately so that the patient can skip the tissue expansion phase. So in this way, the breast implant is placed as a single-staged or immediate breast implant. Because the nipple and the areola are spared, there is no need for a nipple or an areolar reconstruction. For patients that choose to use their own tissues for breast reconstruction or a flap, there are many options available, including taking the tissue from the abdomen, and this can include the DIEP, SIEA, or tram flap, from the back or the latissimus flap, or from the inner thighs or buttock regions, such as the pap flap or tug flap. In these cases, after the flap is performed, several months later, balancing procedures are often needed to improve the symmetry between the two breasts. And again, this can be followed by a nipple reconstruction, followed by an areolar tattoo. For patients that require chemotherapy, they will often undergo a mastectomy with the placement of a tissue expander. After a few weeks pass for recovery, they will undergo their chemotherapy, which lasts several months. This will be followed by an implant exchange or placement of a flap procedure at that time after the chemotherapy. Again, this is followed by balancing procedures, nipple reconstruction, and then an areolar tattoo. In other instances, radiation therapy is also required. For these patients, they will have the mastectomy with a tissue expander. This will be followed by their chemotherapy, and after the chemotherapy, radiation therapy is initiated. This will typically last 5 to 7 weeks. At the conclusion of this, the patients will be given a period to recover, and then oftentimes we will recommend a flap procedure to reconstruct the breast after radiation, although an implant is still possible in some instances. After the flap procedure, we will again proceed to balancing procedures, nipple reconstruction, and then areolar tattooing. In other instances still, neoadjuvant chemotherapy is needed. This means that chemotherapy precedes the mastectomy. After the neoadjuvant therapy, the mastectomy is performed and often a tissue expander can be placed at that time. This would then be followed by radiation therapy, and after that, the remainder of the reconstruction is performed, and this can include flap procedures, balancing procedures again, as well as nipple reconstruction and areolar tattooing. So, as you can see, depending on whether a patient needs chemotherapy or radiation therapy, the timeline and the types of procedures that are performed for breast reconstruction can vary. For more information about breast reconstruction, please see the other presentations on our website, or please make an appointment to see one of our board-certified plastic surgeons by calling 314-996-8800 or follow us online at www.westcountyplasticsurgeons.westall.edu. Thank you.